Hello everybody, my name is Hassan Nafid. I'm an anatomy and physiology instructor at Madison College in Wisconsin. I will continue talking about the series of the human body anatomy and physiology. This time we're going to talk about the abdomen and the pelvis, or what is known as the abdominal pelvic area. The abdomen and the pelvis are important part of our body. Most of the internal organs are found in the abdomen and the pelvis. Most of the organs of the digestive tract are found in the abdomen, and most of the organs of the urinary system are also located inside the abdomen or intra-abdominal. The abdomen also keeps a lot of important glands and other accessory organs like the liver, the pancreas, and so forth. For the purpose of description and for the importance of these areas, the abdomen is divided into 9 regions. This is done by imaginary 4 lines, 2 horizontal lines, and 2 vertical lines. We are going to look at the model here and identify these areas. If you take a look at the human model here, these are the lines, 2 vertical lines and 2 horizontal lines. These areas are identified as follows. On the right side here of the model, this is an area below the costal margins or below the ribs, and is known as the right hypochondrium or right hypochondriac area. Next to it, this area lies on top of the stomach and is known as the epigastric region. The area to the left, far left, and beneath or below the costal margin is also known as the left hypochondriac region. On the right side here, this is known as the right lumbar region. The area or the region after this here, as you see here, this is the umbilicus or the belly button. This area is known as the umbilical region. Next to it, on the left side, this is the left lumbar region. Go back to the right side here. We could identify the right iliac region. It is also known as the right inguinal region. This region is known as the hypogastric region, or it is also known as the suprapubic region. The last region here is the left inguinal region or the left iliac region. So these 9 regions are important in the clinical practice and in the descriptive anatomy, because underneath this region we're going to identify important organs that are related to these regions. I'm going to remove the cover here to show you these organs that we could identify below these areas. I'm going to take this off and show you what we're talking about. Here, as you can see, in this human model, the area we just described, I'm going to put it back here to just kind of quick give you a clue about it. If I remove this away, you are going to identify here on the right hypochondriac region. You see there's liver and the gallbladder. So probably diseases of the liver and the gallbladder might present with discomfort or pain in the right hypochondriac area. The epigastric area, put it back here again, exactly, it lies on top of the stomach, and this is known as the epigastric because the prefix epi means above. So that is above the stomach, and this is the area that the patients will feel discomfort or nausea in this area when there is a disease or a pathology that is affecting the stomach. On the left side here, if you can see, you could identify this organ here, which is the spleen. And this is the area known as the left hypochondriac region. Again, if you go back to this area, you identify here in the right lumbar region, you could identify the colon, ascending colon. See that? I'm going to turn it a little bit so you can see. And the kidneys also, and part of the small intestine. You go in the middle where you can imagine the umbilical region. This is where you find the small intestine. So diseases of the small intestine or any gastroenteritis might present with diseases or discomfort in the umbilical area. To the right lumbar area also, this is the area of the colon, the descending colon, and these are areas where discomfort of colitis might be felt. If I took this off here to show you a little bit, you're going to see the colon behind it. Going back again to the area on the lower part here, which we call the right inguinal region, right here. That's where you find your appendix. So pain of appendicitis might present with discomfort or pain here. Take a look at that. The vermiform appendix is found in this area or the large colon. Going back to the suprapubic area here, this is the area where you identify the bladder. So diseases of the bladder or cystitis or urinary tract infection might present with pain in the suprapubic region. And also on the left inguinal region, you could identify the sigmoid colon, part of the sigmoid colon, and part of the descending colon or descending bowel. So, generally speaking, these organs are represented on the surface of the abdomen by phenomena, by discomfort, by pain, or any other symptoms that might point to these organs which present by discomfort or any form of symptoms that will underlie the surface of the abdominal regions. Abdominal regions are used most and more in the clinical practice to describe symptoms, to analyze symptoms, to write reports, to do investigations, abdominal ultrasounds, or X-ray, or CT scan, with a specific reference to the areas affected in these regions. Thank you for watching the video, and I will see you in another video of our anatomy and physiology series.